Malignant tumors. Epithelioid hemangioendothelioma. Epithelioid hemangioendotheliomas can occur in children, but are most common in adults between 30 and 50 years of age. They usually occur in the liver, lung, or in bone. They may be either fast-growing or slow-growing. In about a third of cases, the tumor spreads to other parts of the body very quickly. Signs and symptoms. Signs and symptoms depend on where the tumor is. On the skin, the tumors can be raised and rounded or flat, red-brown patches that feel warm. In the lung, there may be no early symptoms. Signs and symptoms that occur may include chest pain, spitting up blood, anemia, weakness, feeling tired, or looking pale, trouble breathing, from scarred lung tissue. In bone, the tumors can cause breaks. Diagnostic tests. Epithelioid hemangioendotheliomas in the liver are found with CT scans and MRI scans. See the General Information section for a description of these tests and procedures used to diagnose epithelioid hemangioendothelioma and find out whether the tumor has spread. X-rays may also be done. Treatment. Treatment of slow-growing epithelioid hemangioendotheliomas includes the following. Observation. Treatment of fast-growing epithelioid hemangioendotheliomas may include the following. Surgery to remove the tumor when possible. Immunotherapy, interferon, and targeted therapy, thalidomide, sorafenib, pazopanib, sirolimus, for tumors that are likely to spread. Chemotherapy. Total hepatectomy and liver transplant when the tumor is in the liver. Angiosarcoma of the soft tissue. Angiosarcomas are fast-growing tumors that form in blood vessels or lymph vessels in any part of the body, usually in soft tissue. Most angiosarcomas are in or near the skin. Those in deeper soft tissue can form in the liver, spleen, and lung. These tumors are very rare in children. Children sometimes have more than one tumor in the skin and/or liver. Risk factors. Anything that increases your risk of getting a disease is called a risk factor. Having a risk factor does not mean that you will get the disease. Not having risk factors doesn't mean that you will not get the disease. Talk with your child's doctor if you think your child may be at risk. Risk factors for angiosarcomas include the following. Being exposed to radiation. Chronic, long-term, lymphedema, a condition in which extra lymph fluid builds up in tissues and causes swelling. Having a benign vascular tumor. A benign tumor, such as a hemangioma, may become an angiosarcoma but this rare. Signs. Signs of angiosarcoma depend on where the tumor is and may include the following. Red patches on the skin that bleed easily. Purple tumors. Diagnostic tests. See the General Information section for a description of tests and procedures used to diagnose angiosarcoma and find out whether the tumor has spread. Treatment. Treatment of angiosarcoma may include the following. Surgery to completely remove the tumor. A combination of surgery, chemotherapy, and radiation therapy for angiosarcomas that have spread. Targeted therapy, bevacizumab, and chemotherapy for angiosarcomas that began as infantile hemangiomas. A clinical trial of targeted therapy, radiation therapy, and surgery with or without chemotherapy.